Hello, I am Dr. Anis here to guide you through important clinical questions and concepts of NEETMDS and INICET. So let's look at what happened during a single beat of the heart and how these events are depicted in an ECG. So in normal heart, each beat begins in the right atrium with an action potential signal from the SA node. So this is right atrium, this is right ventricle, this is left atrium, and this is left ventricle. So in normal heart, each beat starts here from the SA node. SA node is also known as the natural pacemaker of the heart. Now then the signal spread across both the atrium and causing the muscle cells to depolarize and contract, inducing a phase known as atrial systole. So this atrial systole represents in the ECG by this P wave. So P wave represents atrial contraction or atrial depolarization or atrial systole. Now the period of contraction that follow the atrial systole and precedes the contraction of ventricle is depicted in the ECG by this PR segment. Now the flat line following the P wave, this flat line following the P wave when the signal passes through the atria and enters the ventricle via AV node. So AV node is located in the interatrial septum. Here the AV node is located. So when the action potential from the SA node comes to the AV node and comes via the AV node, then the ventricle starts to contract. So this ventricle contraction depicted in the ECG by this QRS complex. So QRS complex represent the ventricular contraction phase, also known as the ventricular systole. Also we can say ventricular depolarization. Now from the AV node, the action potential comes to the bundle of His, and from the bundle of His, it comes to the Purkinje fiber. So Purkinje fibers are all along the walls of the ventricle. So now this T wave after the QRS complex, this T wave represents the ventricular relaxation phase, also known as the ventricular diastole. Also we can say ventricular repolarization phase. So P wave represents atrial contraction or atrial systole. QRS complex represents ventricular contraction, also known as ventricular systole, and the T wave represents ventricular relaxation phase, also known as ventricular diastole. So remember these points and please like and share the video. This is the part 1 of the ECG, and the applied aspect of the ECG comes in the part 2. For the part 2, please subscribe and follow my channel Rohini Dental Care by Dr. Anis Das. Thank you.